I'm Todd Weinberner. It is 12:38. Good to have you here on this Thursday afternoon. You know, we just heard a report a few minutes ago from RFD Illinois about the Farm Bill and about the SNAP program. Our first guest today is focusing on those things, but while government officials are mostly concerned with the costs of these programs, my guest is concerned with nutrition. Carolina Schneider is a registered dietitian. In fact, her social media followers know her as the Green RD, and she's here to talk about the Farm Bill and about the nutrition in the Supplemental Nutritional Assistance Program, the SNAP program. And if I can push the right buttons, we will get Carolina on the line. Carolina, good afternoon. How are you?
Hi, Todd. I'm great. Thank you so much for having me.
Well, it is good to have you here because the discussion that comes with the Farm Bill is always extensive. So I thought maybe you could give us some insights. The Farm Bill gets a lot of attention. Can you help us understand why the average person should be concerned with the Farm Bill?
Absolutely, Todd. So the Farm Bill can truly either promote or hinder the development of local and regional food systems. So when we're supporting initiatives related to the Farm Bill, we're really also supporting the access to fresh, locally sourced foods to all. And the bill can truly contribute to healthier diets and stronger local communities. Todd, and you mentioned SNAP, or Supplemental Nutrition Assistance Program. Well, the Farm Bill includes provisions to support SNAP. So any changes in the funding, the eligibility criteria, and the program structure within this bill can also have implications, on the amount of access that people have to nutritious foods. And that's millions of people, as you know, Todd.
Well, can we give a little more clear definition? And obviously you understand this, but I think a lot of us who've never had direct contact with the SNAP program don't even really appreciate what it is. So how would you define the SNAP program?
Yeah, so it's essentially governmental assistance to, less fortunate, those in need. It's defined by your income. So the same way that we have, Medicare, we have SNAP to help people increase their access to food in general. And obviously we are promoting nutritious foods as a priority. But the SNAP actually helps in about 40 million Americans put food on their table each month, Todd. And this is important because many of these families have children. So it's many children and families that are dependent on these SNAP benefits. It's originally called food stamps, so maybe a lot of people know it as food stamps. So that's what SNAP is. And about 70% of these beneficiaries are in families with children. So that's why it's so important for us to make sure these people are having access to the best food options.
Well, I'm glad you said the best food options, because just getting your hands on food is not enough. And I know you have some concerns about the nutritional component of the SNAP program. So what are your concerns? What do you think is the missing element here?
Yes, so as you said, with SNAP, they do have access to food, and there are a lot of healthy foods that are a part of SNAP that people have access to: fruits, vegetables, grains, proteins. But what it lacks is explicit guidelines concerning the quality and the nutrition value of these foods. And it also lacks something I want to talk to you about today, which is the vitamin D supplementation, Todd. So we know from the past few years, going through the pandemic, that vitamin D is absolutely essential for good health and preventing disease. And most of us are deficient in vitamin D. So that's something that's not included in SNAP that I strongly, I'm here advocating for, so that people also have access to that supplementation.
I'm a little confused because, obviously there's a kind of milk you can pick up at the grocery store called vitamin D milk. And I've been told that the sunlight helps our bodies generate vitamin D. So how can we be deficient in vitamin D?
Yes, a great question. So as we know from research, getting vitamin D from sunlight and from foods is not adequate or sufficient in many of the situations. So when it comes to sunlight, we know we can produce vitamin D from sunlight. However, we're also being told to not be exposed to sunlight, to not be under the sunlight for too long, right, because of perhaps other health risks. We're also, always inside wearing sunscreen, and we have to take into account populations that live in areas where sunlight is not as always accessible, right, in the winter times, depending on their geographic location. We also know that a lot of people cannot absorb or metabolize correctly when it comes to foods that have vitamin D. So getting vitamin D from sunlight and just foods, it's really not realistic, Todd. We're seeing this, that people have inadequate vitamin D levels in their blood, and that we do need supplementation in many cases, even myself, to make sure we get the appropriate levels.
I guess the obvious question that I missed, Carolina, is, we hear a lot about vitamin C, and it boosts the immune system, and vitamin K, I've been told, is good for eyesight. What does vitamin D actually do for us?
Yes, so vitamin D supports our immune system, and vitamin D deficiency is associated with preterm birth, depression, respiratory infections. We saw that during COVID. We did a lot of research on vitamin D deficiency and increased risk for COVID, asthma, cancer, and chronic diseases such as type 2 diabetes and cardiovascular disease. So vitamin D plays a very important role in our body, and supporting our immune system is one of these big roles. So essentially, it keeps us our immune system working properly. So I'm glad you asked that.
Well, I guess my question would be, what exactly are you advocating for? Are you suggesting that supplements should be part of the SNAP program, or is there another approach?
Yes, Todd, so a few things. One thing is getting at least into the bill so that people have that option, right? So at least there is an option to get the vitamin D supplementation if they are in need. We obviously always recommend people to get their blood work done regularly, every 6 months or every year at the very least, so that they know whether or not they need the vitamin D supplementation in the first place. But Todd, it's what people can do from home. It's actually very easy to just ask your elected officials of Congress to add vitamin D to the Farm Bill. We have a website. It's allforvitamind.com. And again, it's just getting that option for people so that if they need the vitamin D supplementation, it's something that's included in their SNAP benefits.
I realize we're focusing primarily on the Farm Bill, but would you recommend that the rest of us head for the drugstore and pick up a bottle of vitamin D supplements?
Yes, if you are deficient or if you're at a higher risk. So what I would recommend first, Todd, is to make sure that you work with your primary care physician to get your blood work done regularly, again, every 6 months or every year at the very least. And then if you are on that lower range, absolutely, because vitamin D does play such an important role in our health. So I mentioned that I take it as well. I don't get enough from food. I'm actually on a plant-based diet. So that's another point, Todd. If people have any dietary restrictions, it might be more difficult for them to get vitamin D from foods also. So yes, definitely get your blood work done. And if you need vitamin D, go get some.
Okay. Well, let me ask you this. Now, the Farm Bill, as we said right at the beginning, is always contentious. There are always long meetings, debates, different sessions, getting input. So what can people do now? What if a person is concerned about these issues and would like to see these things moving forward? What would you have them do?
Yes, so you can definitely help us kind of raise awareness, but also ask your elected officials of Congress to add the vitamin D to the Farm Bill. So people can go to allforvitamind.com. And really, it's so easy because the Organic and Natural Health Association already wrote the letter that you will send to, your member of Congress. And all you have to do is go to the tab where it says Take Action and fill up your personal information. It's just your name, your email, your address, and then the letter's already written for you. So if you want to personalize it, you can, but that's essentially it, Todd. You just fill your information and you submit the letter to kind of help us get that awareness and that push towards the vitamin D and the bill. But also, Todd, just quickly, I wanted to let people know, if you're listening and if you are a SNAP beneficiary, you can also have access, know that you have access to natural groceries. So you can Google Natural Grocers directory or in the INFRA store directory. You can look at the independent grocery stores and natural produce stores, that you have access to, which helps you get more nutritious foods. So that's another great thing that people can do to improve their nutrition.
Well, Carolina, we are out of time, but it has been great talking with you about these issues. Is there a place where people can find out more? You mentioned the website for the vitamin D issue, but is there someplace else where people can learn more about you and your ideas?
Well, yes, you can find me on Instagram, Carolina the Green RD, and all the information on what we talked about today is at allforvitamind.com.
Allforvitamind.com. Well, we hope people check it out because it's been a day or two since I took my Flintstones vitamins, and so perhaps it's something I should get back up to speed on. Carolina, thank you for being with us. We appreciate it.
Thank you so much for having me, Todd.
And that's Carolina Schneider. She is known as the Green RD, registered dietitian and health educator. And we've been talking about the Farm Bill and about the SNAP program.